Hello, welcome back to the channel. In today's video, we're going to talk about how to get into healthcare IT. So first, let's talk about what's healthcare IT. So healthcare IT, it's pretty much stands for healthcare technology, and that pretty much involves any role within a healthcare organization that involves IT. So I'm thinking of roles like, healthcare IT analyst, EHR analyst, EHR developer, IT support, any roles that really is within the IT department of any healthcare organization. We're talking about that specifically because it's a very good space to be into because there's a lot of remote jobs there, and we know in 2025 at least remote jobs are very difficult to find, and a lot of people really want to get into working remote, and being able to have that ability to work remote is very important. Unfortunately, in 2025, no, a lot of companies are hiring remote, but in the healthcare industry, there's still a lot of remote jobs just because if you work for a healthcare organizations, the main role is to take care of patients. They're not in the business of building new technology. They are in the business of taking care of patients. So that means, their facility is really prioritized to patients. They majorly they pretty much focus on providing all the space to patients instead of providing the space to the IT department. So that's why a lot of in a lot of healthcare organizations, the IT departments are usually remote, and this is why you want to get into healthcare IT, or if anybody is already in the healthcare IT, you want to remain in the space, right? So yeah, so let's talk about what do you need in order to get into healthcare IT. So really, you need an IT background, right? You don't have to have a medical background. You just need an IT background. Once you have an IT background, whether you have a associate degree, bachelor degree, or master degree, or even PhD, or whatever, or even if you just have previous experience within the IT space, it's enough for you to get into healthcare IT. You don't necessarily have to have a medical background to get into healthcare IT. Now, if you come from a medical background, it's a plus, right? It's good. Like let's say if you're a nurse, or if you are a technician at the hospitals, then it's or you already have one foot into the door because you're already working for the organization for that hospital. So really, all you need to do is network with the IT department, and you're gonna get it. And to be honest, from my experience being in healthcare IT, I've noticed that the people who seem to do the best in healthcare IT, especially when it comes to the EHR side of IT, I've noticed that the top performers usually have a medical background because it does help to understand. The medical background helps to understand workflows, um, test case scenarios, and when it comes to implementing new projects and all that stuff, having that medical background heavily helps, versus as a traditional IT guy, you don't have that experience. You only know the tech side, but then that person from the medical side comes with a medical background and then learns IT, mix the two together. Yeah. So yeah, so from a technical standpoint, what skills do you really need? Well, um, you can, if you have a programming background, that's awesome. There's a lot of things that you can do. Really, if you have any networking certifications, or any cloud experience, that's also good. Really, any basic technology skills like SQL, SQL is huge, right? Because data is everywhere, so you definitely SQL is like a must, right? Yeah, any programming skills is good because you always want to make sure that programming skills is at least intermediate. You don't have to be an expert, but know enough to be able to be open to opportunities. SQL, of course, yeah. And then, yeah, so those are really, or any certification like CompTIA, or even if you are familiar with platforms like Cerner, EHR, or Epic, that definitely will get you into the door as well. So yeah, and what do you actually, now that we've talked about, what healthcare IT, what degrees or what certifications or previous experience that you need to get into it. Let's talk about how to get your first job. So now, really, there's a couple different ways you can approach this, right? You can try to work for go for hospital route. That means you work directly for the hospital, which I highly recommend, because when you work for the hospital, creating the technology is not the main focus of the hospital. The main focus of the hospital is to take care of patients. So you're not going to be at the center of the action. But then another way is to go work technology companies for a technology company that builds technology for healthcare organizations. So like companies like Cerner or Epic or Meditech or whatever. Um, so then you will go work for one of those companies, and then you will work, probably as an engineer or maybe as an analyst. You'll pretty much, be working for a tech company that just happens to serve healthcare clients. In that case, you might not get all the flexibility that someone who works for a healthcare organization gets, but then usually the pay is probably slightly better because tech companies have a higher standard or have a higher view and compensation for the tech employees, for the technical engineers versus like hospitals. In the hospital settings, the IT engineers, IT analysts, the main they're not in the center of the action. So that means their budget is really an afterthought. But then when you are in a technology company, when you're in the center of an action, then the tech engineers are in the center of the action. So that means the salaries are usually the first start. So that's the only difference there. Salaries may sometimes vary, but if you work for a good healthcare organization like a good hospital, salaries can be in the six figure. It's just, they're not always that way. A lot of times you're gonna see engineers making 80, 90 grand, depending on where you live. It could be good, but then eventually you can find hospitals that can pay in the six figure, depending on the experience and depending on the role that you're doing. Also, if it's a very technical role, like if it involves programming, usually you have a good chance to be in the six figure. So that's why I talked about programming earlier. So then also you can try to see another way is to try to work with like consulting companies. There's a lot of consulting companies out there that happen to have healthcare clients, and that's also another way you can kind of get into it. And then yeah, you can just go to the website, search for healthcare IT consulting companies. That's another easy way to get there. Now they not necessarily going to require you to have medical background, but again, IT, they really focus on the IT side of things. And then once you have the IT background, especially SQL, Python, really one or two major programming language and SQL, I guarantee you it's enough to get into the door. So yeah, because from there, once you know SQL, then you understand data, and data is huge in healthcare technology. And with one programming language, whether it's like Python, Java, or even C Sharp, you can easily navigate to learn the next one, and then that's enough to get you going. And many of those roles don't always imply programming, but it's nice to have that programming background so you can understand the system on a deeper level. Because having that programming language background, that programming background, even if you don't code on a regular basis, but it will really help you to be able to dig deeper, because a lot of the logic is built with code. So so knowing that code, having that coding background definitely helps to dynasties to troubleshoot issues and stuff like that. So and then yeah, so let's talk about salaries and career outlook and all that stuff. So yes, like I said earlier, when it comes to salaries can range anywhere from in the low 50s to in the six figure. Well, for entry level it's more in the low 60s to 70s. So yeah, which is not bad if you're just coming out of college. Now if you've been out of college for a while, you got 5, 6, 7 years of experience or whatever, that's a very low pay. But again, if you're trying to switch careers coming from a different industry, then I guess you may have to start with a low pay, but then understand that you're gonna have to build yourself up, learn very quickly so you can move up, have an impact, get promoted, or hopefully go to a different organization that is willing to pay you more. So yeah, the goal here is really, really give you a basic understanding of what healthcare IT is, and and the flexibility that comes with it, especially when it comes to working for hospitals, like in healthcare organizations that actually receives patients, because you're not in the middle of the action, and most of the times they will provide you remote opportunities or hybrid opportunities, and in 2025 is very very difficult to find. So I hope this video was helpful to you. Make sure you leave a comment if you are in the space.